Today we're going to go over medications. Drug names. There are three names a drug typically has: a generic name, an official name, and the brand name. There are 6 rights of medication administration: the right medication, the right dose, the right time, right route, right patient, and right documentation. There are some considerations to remember when dealing with pregnant patients. There will be an increase in maternal heart rate, cardiac output, and blood volume, which may affect absorption, distribution, and effectiveness of the drug. Some drugs may cross the placenta, and some drugs may cross into breast milk. There are a few things to remember when dealing with pediatric patients: decrease in oral absorption, increase in topical absorption due to thinner skin, they have altered metabolic rates, have a lower metabolism rate, and weight-based drug dosing is important. Geriatric considerations. Geriatrics have a lower oral absorption rate, lower muscle mass and higher body fat, lower liver and renal functions, may be on multiple drugs, and or have multiple diseases. Administration routes. Intravenous is the fastest, however it is the most dangerous. Endotracheal, for ALS only, includes lidocaine, atropine, Narcan, and epi. Inhalation, bronchodilators via nebulizers, and transmucosal, rectal or sublingual. Intramuscular, subcutaneous, and oral, although it can be slow and unpredictable and is rarely used in pre-hospital. Factors altering drug responses: the patient's age, the patient's weight, and the patient's gender. The environment, patient's temperature, and shock. Pediatric patients have a higher proportion of water. They also have immature liver and kidneys. The liver often metabolizes slower, and the kidneys may excrete slowly. Geriatric patients could have chronic disease states, slower metabolism, slower excretion through the kidneys, dietary deficiencies, the use of multiple medications, and lack of medication compliance. Medications we can administer: albuterol, Atrovent, aspirin, nitro, D50, glucagon, glucose, epi, and Narcan. Albuterol. Indications: wheezing symptoms associated with asthma, COPD, emphysema, chronic bronchitis, and allergic reactions. Contraindications are going to be an allergy or known hypersensitivity to the drug, and tachycardia. Please note that this drug will also cause tachycardia. The dose for albuterol is 2.5 milligrams in 3.0 milliliters of normal saline, given via handheld nebulizer or nebulizer mask. Administration: it may be administered via handheld nebulizer or nebulizer mask. Oxygen should be set at 6 to 8 liters per minute and may repeat as needed as long as there are no contraindications. Atrovent, also known as ipratropium bromide. The indications are wheezing and bronchospasms associated with chronic bronchitis, bronchial asthma, and emphysema. The contraindications are an allergy or known hypersensitivity to Atrovent and acute treatment of bronchospasms. Precautions: use with caution in patients with heart disease, hypertension, glaucoma, and the elderly. It may worsen the condition of glaucoma if it gets in their eyes. Have the patient close their eyes during the nebulizer to prevent this, or use a nebulizer mask. Atrovent side effects. Some common side effects are dry mouth, cough, unpleasant taste. Some uncommon side effects are vision changes, eye blurring or pain, dizziness, headache, nausea, nervousness, palpitations, sweating, trembling, increased wheeze or dyspnea, chest tightness, rash or hives, and facial swelling. The dose of Atrovent is 0.5 milligrams in 2.5 milliliters of normal saline. It should be given as what is called a duoneb. Mix the entire contents of Atrovent and albuterol into a nebulizer chamber and give as one treatment. The oxygen should be set at 6 to 8 liters per minute. Aspirin. The indications for aspirin use are suspected cardiac ischemia. Precautions. Recent internal bleeding within the last 3 months, known bleeding disorders, recent surgeries, currently on a blood thinner, Coumadin or warfarin, GI bleed, or current asthma attack. More contraindications are an allergy to aspirin or other nonsteroidal anti-inflammatory drugs, for example, Tylenol, Advil, Aleve. Administration. Ensure that the patient is able to swallow and give up to 324 milligrams PO, 81 milligram tablets each of the children's chewables. If the patient takes their aspirin daily, give up to the amount of 324 milligrams. Nitroglycerin. Indications. Chest pain of suspected cardiac origin, CHF, and a hypertensive crisis. Contraindications. Allergy or known hypersensitivity to nitroglycerin. Blood pressure of less than 100 systolic. Precautions. Headache and hypotension may occur after the administration of nitroglycerin. Blood pressure of less than 100 systolic. Viagra or sexual enhancement medications within the last 24 to 48 hours. They already took 3 nitroglycerins, and under 12 years of age need medical control approval. Nitroglycerin administration. Step 1. Start an IV. Give 0.4 milligrams of sublingual nitroglycerin. Retake the patient's blood pressure. Repeat the nitroglycerin as necessary. Take blood pressure. Repeat nitroglycerin if necessary, and take the patient's blood pressure. It is important to have a blood pressure before and after every nitroglycerin dose. Dextrose 50% or D50. Indications. Suspected or known hypoglycemia. Blood sugar of less than 80 and symptomatic. Precautions. Infiltration can cause tissue necrosis. Contraindications are hyperglycemia. Administration. Start a patent IV line, preferably greater than 20 gauge. Administer 25 grams to the adult patient, IV push. Administer 12.5 grams of D25 to the pediatric patient. See the next slide for directions. Repeat the blood sugar. How to make D25. Waste half the amp of D50. Draw 25 milliliters of saline from an IV bag. Now you have D25. We use D25 on the pediatrics because it's easier on their system and has the same effect on the body as D50. It can be repeated if needed. Glucose. Indications. Known or suspected hypoglycemia. The blood sugar must be less than 80 and the patient must be symptomatic. Precautions. The airway must be maintained. Administration. Administer 1 tube of oral glucose gel. Place in upper cheek area on both sides. There are 15 grams of glucose in each tube. Glucagon. Indications. Suspected or known hypoglycemia in diabetic patients where an IV line has not or cannot be placed. Precautions. This is relatively free of adverse reactions. It will not work if there are no glycogen stores in the liver. Administration. Reconstitute the drug. Add 1 milliliter of saline to 1 milligram of the drug. Roll the vial to constitute the drug. Draw up 1.0 milligrams of the drug and administer IM injection. The drug is 1 milligram in 1 milliliter of saline. Epi 1 to 1000. Indications: severe allergic reactions from any form of allergen. Precautions: known cardiac disease or asthma exacerbation. Epinephrine 1 to 1,000. Administration: adult. Give 0.3 milligrams of sub-Q injection. May repeat if necessary. Child: give 0.15 milligrams injection subcutaneously. May repeat if necessary. Narcan reverses respiratory depression or depressed mental state from narcotic overdoses. Diagnostic establishes that depressed mental state or respiratory depression is due to narcotic overdoses. Contraindications: allergy or known hypersensitivity to the drug. Precautions: in the chronic narcotic abuser, it may precipitate withdrawal symptoms or seizures. It has a very short half-life. Watch patient closely and prepare to redose if deterioration occurs. Administration: initial dose 0.4 milligrams to 2 milligrams IV push. When respiratory depression subsides, stop administration of the drug. Watch closely for deterioration and redose if necessary. The end.